For some women, it's hard enough trying to fall pregnant. And then on top of that, they are given a diagnosis of having fibroids. Is that you? Well, you've clicked on the right video, because in this video, I will be addressing how you can fall pregnant despite having fibroids. Hey, Dr. Kady here. I'm a board certified family doctor. Welcome once again to Hey Doc, and we are back with another fertility video. First of all, let me just say, if you've been told that you've got fibroids, you are not alone. It is estimated that 70 to 80% of women would have been given a diagnosis of fibroids by the time they reach the age of 50. So you see, fibroids are an extremely common condition. That's why in this video, we will look at what fibroids are, what causes fibroids. Then we will address how fibroids affect your fertility if you've been given a diagnosis of fibroids. And finally, we'll leave the juiciest part to the end, which is how you can still fall pregnant despite having fibroids. Uterine fibroids, also known as leiomyomas or myomas, are non-cancerous growth that develop within the muscular wall of the uterus. And they are the most common type of benign tumors found in women of reproductive age. They vary in number as well as in size, and they can range from being rather small to being quite large. And they can be so large that they can actually distort the shape of the uterine cavity. Before we go into this video, I'm sure someone is saying, stop, Dr. Kady. Can you please tell us why fibroids happen in the first place? The answer to that is that it's not quite clear why fibroids develop in the first place. But what we do know is that the uterus is mainly made up of a type of smooth muscle known as the myometrium. And when there is a localized overgrowth of this type of smooth muscle, it forms a tumor mass known as a fibroid. And fibroids are extremely sensitive to the female sex hormones known as estrogen and progesterone. Fibroids tend to get bigger when these hormone levels are high, for example, in pregnancy. And when a woman reaches the end of her reproductive years, the fibroids will shrink because the levels of these hormones drop. Studies have been able to consistently show that fibroids are more prevalent and tend to happen at a younger age in women of African descent. And that is in comparison to other ethnic groups. When it comes to symptoms related to fibroids, countless are the women who have absolutely no symptoms from having fibroids. On the other hand, some women will experience the following symptoms: heavy menstrual bleeding, pelvic pain or pelvic pressure, difficulty in completely emptying your bladder, and would you believe, if the fibroid is big enough, it can cause the woman to have low back pain. And then there is, of course, women whose fibroids are so large that they actually cause abdominal swelling or bloating. It is important for doctors to be able to classify the fibroids. And the way we do that is to describe the fibroids according to its location within the uterine cavity. We have intramural fibroids. These grow within the muscle tissue of the womb, otherwise known as the myometrium. And the myometrium is the most common place for fibroids to form. Then there are subserous fibroids. These tend to grow from the outside wall of the uterus. Submucosal fibroids. These grow from the inner wall of the uterus, also known as the endometrial lining, into the uterine cavity. Finally, pedunculated fibroids. These grow from the wall of the uterus and remain attached to the uterus by a very fine stalk. This is a good place for us to talk about how fibroids can affect your fertility. Fibroids can affect the fertility in a woman in different ways. It will depend on various things, like their location, the size of the fibroid, and how many fibroids there are. Are we dealing with one fibroid or many of them scattered around the uterine cavity? Whilst many women with fibroids will tell you that they have been able to carry pregnancies quite successfully and have had no difficulties, that unfortunately is not the case for every woman who has been given a diagnosis of fibroids. And for this group of women, fibroids can interfere with various aspects of the reproductive process, and sadly for some women is a major contributing factor to their infertility. The first way that fibroids can affect fertility is by the potential distortion of the uterine anatomy. Large fibroids located within the uterine cavity, so these are the submucosal fibroids, tend to distort the shape of the uterine cavity, making it difficult for the fertilized egg to implant and to grow properly. This increases the risk of implantation failures, early pregnancy loss, miscarriages, or complications during pregnancy. When submucosal fibroids are large enough, they share the space within the uterine cavity with the growing fetus. And so that means that the space that the baby will normally have to freely grow can sometimes be halved. And when these women are able to carry the baby full term, what happens is that there is intrauterine growth restriction, leading to the birth of the baby that ends up being small for their gestation age. Studies have shown that fibroids that do not distort the anatomy of the uterine cavity, mainly the intramural fibroids, will not tend to affect a woman's ability to fall pregnant. So, if you have been told that you have fibroids, the first thing you should be asking your doctor is, "Doctor, which type of fibroids do I have?" If you have been told it is an intramural fibroid of small to moderate size, most of the time you will be able to get pregnant without any problems. The second way that fibroids can affect your fertility is by causing obstruction to the fallopian tube or to the cervix. Fibroids that are located in these two main landmarks may obstruct the passage of swimming sperm cells or even impair the movement of the egg through the fallopian tube. This will obviously interfere with fertilization and reduce the chances of conception. And finally, fibroids can affect your fertility by causing a change in uterine blood flow. Fibroids can alter blood flow to the uterus, leading to a change in the endometrial lining, and this stops the implantation of the fertilized egg. Reduced blood flow to the uterus can also compromise the development of a healthy placenta during pregnancy. And this increases the risk of pregnancy complications such as placental abruption or even preterm births. So, how do we treat uterine fibroids? Okay, so there are two main things to consider. The first is, has the woman completed her family and therefore wants no more children? Or is this woman who has been diagnosed with uterine fibroids trying to preserve her fertility because she either hasn't had children yet or wants more children? Let's deal with the women who have completed their families really quickly to get onto the juicy part, which is what most of you watching this video are going to want to know. Fibroids, as well as, obviously affecting your fertility, which we have just discussed, they can be very, very debilitating in terms of the symptoms. The most common symptom being heavy vaginal bleeding can be very, very disabling and debilitating for some women, affecting their activity of daily living, such as being able to go to work, being able to care for their families, even being able to do simple things like exercise, because they just bleed through their clothes. Some women, the bleeding is so bad that it causes them to feel lightheaded, and when they lose so much blood, it can be as bad as them feeling short of breath. In these women, once we have tried using intrauterine devices such as the Mirena, or we have tried other methods of treatment in order to preserve the uterus, and all of these other methods of treating uterine fibroids whilst trying to preserve the uterus, if a woman has completed her family, it is out of the scope of this video. But once all of these have been explored and the woman continues to bleed quite heavily, the only option really remaining is to carry out a hysterectomy. And a hysterectomy is simply when the uterus is removed. Now, obviously, for most of you watching this video, this is not an option because you want to have a baby. So remember, when a doctor tells you that you have a fibroid, the next immediate question should be, which type of fibroid do I have, doctor? If the doctor tells you that you have a submucosal fibroid, remember these are the ones that grow within the uterine cavity, and sometimes if they're large enough, distort the cavity and leave a smaller space for the baby to grow or even prevent implantation altogether. This type of fibroid is a cause for concern. Therefore, it's not surprising that a study has found that when this type of fibroid is removed, the rate of pregnancy is seen to have doubled. And submucosal fibroids are removed through a procedure known as hysteroscopic myomectomy. This procedure is recommended for small fibroids that do not penetrate deep into the uterine wall. Other ways of removing fibroids include abdominal and laparoscopic myomectomies. With the abdominal route, an incision is made, the pelvis is open, and then the fibroid is removed. This technique, though, is predominantly for intramural fibroids, as well as when there are multiple fibroids to be removed. But removal of an intramural fibroid will lead to scarring. And scarring tissue stretches less than the original smooth muscle that was there before the fibroid was removed. As a result, if you remove an intramural fibroid and you get pregnant, there is a risk of rupture to the uterus simply because you've lost some of the elasticity that would have been found in the original smooth muscles, now replaced by scarring tissue. Laparoscopic myectomies offer benefits such as shorter recovery time, less postoperative pain, and there are reduced risk of complication with laparoscopic myomectomies in comparison to abdominal myomectomies. So, in summary, should you remove uterine fibroids if you are trying for a baby? I would say the first question you need to be asking is, what type of uterine fibroid? If the doctor tells you that it is a submucosal fibroid, particularly when you have several submucosal fibroid, then these will be well worth removing. And the preferable way to remove these is laparoscopically. If you want a baby and you've been told that your fibroids are intramural, these do not interfere with implantation because they do not distort the uterine cavity. In fact, sometimes if there are many intramural fibroids and you try to remove these, you are actually causing scarring, and this can cause you further problems. So if they're intramural, you're trying to have a baby, they are not going to interfere with implantation, so leave them alone. It's time for the scripture. Today I'll be sharing from Luke chapter 1, verse 45. The word of the Lord reads, "Blessed is she who believed, for there will be a fulfillment of those things which were told her from the Lord." Do you believe? Do you trust that the Lord is able to perfect all that concerns you, including your desire to have a baby? He who has created the ear, will he not hear your supplication and your desire and your prayer unto him to have a baby? Hold on. Trust him, knowing that his word says that no one who waits on the Lord shall be put to shame. That's it for this video. Thank you so much for watching. Remember, before you leave, subscribe, smash the like button, and do remember to share. And until then, we will see you in our next video. Take care.